Hello and welcome to our presentation, a case study in scaling out an adaptation of an evidence-based program for the Society for Prevention Research 2020 annual meeting. Here you can see our poster. We'll be going through this information during the presentation, and I would direct you to our handout, which has a better quality version of this. In terms of the agenda for our presentation, we'll start off just with some background information and the objective of our research, do a brief description of the initiative that we're looking at, talk about our methods for the study, go through some facilitators scaling out as well as the challenges that came up in terms of scaling out, and we'll discuss our recommendations for similar initiatives and some final conclusions. By way of introductions, the voice you're hearing, this is Sam Beckwith. I'm a senior research analyst in the youth development program area here at Child Trends. And the other presenter author of this poster is Brendan Stratford, who's the deputy program area director for education research also at Child Trends. The background for our study is that while scores of behavioral health interventions for children and adolescents have been developed and rigorously evaluated over the past several decades, relying exclusively on tested and proven interventions can disadvantage historically marginalized groups of youth for whom few such interventions may exist. Meanwhile, adapting interventions that have proven track records to better meet the needs of these marginalized groups is one potential solution to this problem. Scaling out, which is the process of adapting a well-established, effective intervention for a new setting or new population, can address a disconnect between the typical methods of establishing evidence and the needs of practitioners who are working with marginalized groups. So the objective for our research was really to learn how and why service providers and public agencies may participate in an initiative that's focused on scaling out a proven intervention. So to start providing some information about this initiative, the focal intervention was multisystemic therapy for emerging adults, or MISTE, which is an adaptation of the rigorously evaluated and widely implemented multisystemic therapy, or MST, program. MISTE in this current initiative also represented an adaptation from earlier MISTE implementations, which were focused on juvenile justice settings. So this adaptation also included emerging adults who were engaged in the child welfare system, as well as those in the juvenile justice system and dually involved young people. 2 neighboring jurisdictions participated in the initiative, and we'll be calling them Jurisdiction 1 and Jurisdiction 2. So who were the partners in this initiative? A foundation funding MISTE services for youth in Jurisdiction 1. There was a local government funding agency paying for MISTE services in Jurisdiction 2. A service provider that delivered MISTE services to youth in both jurisdictions. Public agencies in both jurisdictions that made referrals to MISTE. And also the MISTE program developer was involved. To talk through our methods for the study, interviews with 15 stakeholders were conducted in spring and then in fall or winter 2018. So in total, 19 interviews were conducted, transcribed, and analyzed. These interviews focused on motivations for participating in scaling out MISTE, perceptions of whether the initial implementation was successful, and any plans for sustaining the program within each of the 2 jurisdictions. There were visits and meetings that we took part in where stakeholders discussed initiative participation and progress. We attended those. Child Trends also observed portions of the MISTE therapist trainings, and we regularly listened in on cross-organizational check-in calls. And our analysis, we took a grounded theory approach where emergent themes were identified during team debriefs. We examined the way themes varied by interview timing and interviewee affiliation. And finally, the themes that were identified through the interviews were examined in the context of factual and timeline information that we gathered from those initiative meetings, calls, and other updates we received. Our analyses pointed towards a number of factors that influenced stakeholders' decisions to participate in a scale out of MISTI, and four major factors facilitating scale out were identified. The first was optimism that the adaptation would be effective, which was based on the strong evidence base for the original intervention. So nearly across the board, the stakeholders that we spoke with were familiar with the original MST intervention. They noted that they considered it to have significant evidence supporting its effectiveness, and they valued the fact that MISTI was adapted from it. So one representative quote here is, "I guess there's some automatic buy-in when you mention MST just because of the wealth of research behind it, and the infrastructure behind it is just incredible." And that was said to us by a public agency official. The second facilitator that was identified was filling a critical gap for a historically underserved population. So many respondents know that MISTI would fill a gap in effective services for its target population. Public agency staff responsible for making referrals to the program saw it as, and I quote, is an incredible opportunity for some of our hard-to-reach youth, for whom there were limited services. And this perspective was also shared by the service provider staff, who felt excited by the opportunity to engage the target population of emerging adults. And one representative quote here was, "The issue of youth and young adults with diagnosed behavioral health issues and involvement with the juvenile justice system and social services system has been on our map for a long time. It's been on our radar to look for evidence-based interventions that specifically serve that population." We heard that from a public agency official. The third facilitator identified was trust, developed through pre-existing relationships between the public and private organizations. So several partner organizations across both jurisdictions had pre-existing relationships. For example, a respondent from a Jurisdiction 1 public agency noted that the involvement of a foundation that they knew and trusted was enough to take a chance on a new initiative. And the service provider was also known to the local actors, who spoke highly of its work and its ability to communicate. And a representative quote is that, "The service provider stands out in my mind because they have, I would say, evidence-based services in their DNA, and they're, from my experience, in a different league than pretty much anybody else that I've worked with on an evidence-based practice." And that was said to us by a public agency official. And the fourth and final facilitator was the availability of implementation supports for the MISTI adaptation. So between the service provider and the program developer, we heard perceptions that numerous supports were in place to ensure that the intervention was implemented with quality and with competence. Prior to implementation, the program developers assessed provider capacity with a site assessment checklist to determine the fit and readiness for implementation. And the program developers had also provided technical assistance for other MISTI implementations. The service provider organization, meanwhile, had a track record of providing standard MST in the region, and moreover, the MISTI supervisor at the service provider had professional experience delivering standard MST. So we were seeing connections to standard MST not only at the organizational level for the service provider, but also in terms of the implementation team. So in these sorts of initiatives, there are always going to be challenges, and what we heard from respondents indicated that there were two primary challenges related to scaling out MISTI. The first was related to managing differing needs of jurisdictions. Staff at the service provider noted that the two jurisdictions were, quote, very siloed from each other and had differing levels of engagement in the initiative. The result of this was that the service provider had to balance multiple priorities across different sets of stakeholders, and additionally, respondents from each jurisdiction expressed preconceptions about the other, and they were not in regular communication despite being critical partners in the initiative. And this lack of communication extended to not regularly talking about project financing, and this is despite the fact that the initiative involved a complex braiding of funds from multiple sources. This increased uncertainty and heightened concerns about the viability of the initiative among some partners. And the second primary challenge that was identified was the presence of a slow rollout and a long planning period. So stakeholders expressed frustrations due to slow progress in moving the initiative forward and described uncertainties about funding and about partner commitment. there were delays related to securing funding and hiring staff that presented an opportunity cost, especially to the Jurisdiction 1 public agencies. They had a set of federal funds and ultimately chose to devote those to a different program. We know that there will be varying contexts and challenges for any scaling out initiative, but the following takeaways may be applicable for communities that are interested in scaling out interventions. Build on the strong reputation of an established intervention to build confidence among partners. Positive perceptions of related program models can be key in establishing buy-in from potential partners. Ensure the adaptation fulfills an unmet need. Public agencies that offer only a few evidence-based interventions may be receptive to adaptations that give them a more complete service continuum. Leverage existing networks to form effective partnerships. For organizations interested in scaling out, an effective strategy can be to focus on partners that can champion the initiative and engage their existing networks to collaborate. Establish and maintain ongoing, transparent communication about funding from the beginning of the initiative. While receiving funds from multiple organizations can help support sustainability, it can also bring another layer of complexity to the partnership. It's important to take the time early on for partners to determine an equitable approach to funding the joint initiative, and frequent and open communication allows partners to take a proactive, joint approach to identifying and solving potential financial challenges. Invest adequate time and resources into maintaining working relationships across all partners. A crucial part of this is determining the shared priorities for the initiative, motivating partners to work together to address challenges rather than pulling back. Partners who work as conveners should pay close, continual attention to the relationship dynamics in the initiative. And finally, ensure that providers have the capacity for high-quality implementation. Due to the newness of adaptations, there will always be uncertainty regarding program effectiveness. Among service providers, factors such as relevant experience, leadership involvement, training and coaching, and performance management can all contribute to effective and responsive implementation. In conclusion, our findings from this study indicate that a partnership involving multiple jurisdictions and multiple organizations can indeed come together to scale out an adaptation of an established intervention. Public agencies that value evidence-based approaches can be open to investing in untested adaptations of evidence-based interventions, and although challenges are likely, factors that are related to the adaptation and the dynamics of the partnership can help facilitate the scaling out process. So we'd just like to gratefully acknowledge the support that the Annie Casey Foundation gave for this research, and also would note that this poster and presentation is adapted from a forthcoming brief by us to presenters to adapt interventions to serve marginalized youth. Service providers can seek funding from public agencies. So thank you for tuning in, and you can see our contact information here in case you would like to follow up with any questions or comments. Thank you.